McFarland Clinic oncology nurse Pam Luna shares her experiences with the clinic's William R. Bliss Cancer Center as both nurse and patient.
Hi, I'm Pam Luna. I've worked at the William R. Bliss Cancer Center for 21 years as a certified oncology nurse, and 8 years ago the tables were turned and I became the patient when I was diagnosed with stage 2 breast cancer. I felt fairly sure I knew what was coming, and Dr. Guffey, just immediately took care of me, started the whole process with the lab work, getting all the up-to-the-minute clinical trial information. I enrolled in a clinical trial, and it only took 4 weeks from start to the beginning of chemotherapy. I'd been through all the testing, the surgery, enrolled in the trial, and started chemotherapy. For me, the worst part was just finding out that you're diagnosed and you don't really know what you're going to be doing. And once you've had all the testing done and you have a plan and you know, okay, I know what I've got, this is what I've got to do, things get better.
Understanding that knowledge of what to expect after a cancer diagnosis was beneficial for her, Pam offers highlights of the oncology department at McFarland Clinic, from the friendly receptionists to the infusion center, where patients receive a great deal of their cancer treatment.
Walk into our waiting room and be greeted by one of our receptionists, and I think our receptionists are second to none. They're extremely friendly, good at answering questions. When it comes time to schedule things, they work with people to make it convenient for them. We have a lab that is staffed by an RN who draws blood from ports or Grosjean catheters, Hickmans, and a lab technician who does the phlebotomies and kind of keeps organized, gets the lab orders all set. And that doesn't take too long. It's right here, very handy for people. Our infusion center, we have 10 private rooms and one larger room with 4 chairs in it. We have recliners, we have beverages available, cable TV and magazines. You may have already, if you have a port or a Grosjean catheter, have had your IV accessed in the lab. If not, we'll be starting an IV. The nurses prepare the chemotherapy and bring it in. If it's your first treatment, we're going to spend quite a bit of time talking to you about the different drugs and the different side effects and what to do about them. After you've got one under your belt and you kind of know what's going on, people pretty much relax and visit or sleep, watch TV. And of course, once you've got one treatment under your belt and you kind of know what to expect, things get better. But everybody's right up to the minute on all the latest treatment, the clinical trials. The staff is so supportive and kind of tries to wrap their arms around everyone and just be as helpful as we can. And it's hard not to get discouraged, but really there's a lot more happy stories than there are sad stories.
For more information about McFarland Clinic's oncology department, call 515-239-4401 or visit us on the web at mcfarlandclinic.com.